At Eternelle Aesthetics, we have clients coming for mommy makeover. And here we are today to talk about a client's physical, mental, and emotional status when they come for a mommy makeover. I am Dr. Maalavika, aesthetic gynecologist, and this is my colleague Dr. Deepthi. So Deepthi, what do you feel about a client status who comes for a mommy makeover?
Hi, I'm Dr. Deepthi, consultant plastic surgeon, Eternelle Aesthetics, and I have been dealing with mommy makeover from almost 6 to 7 years. Over a period of time, I have always observed that for my clients, coming and taking a consultation for mommy makeover is itself a very big decision. Just for them to mentally prepare for surgery and coming over to the doctor to talk about it is kind of a big achievement for them. So the first thing that we have always observed is to first calm down the patient, which will open up all the doors for the patient. I've always seen patients coming to me with first trivial complaints like say a pimple or a scar or a sebaceous cyst, and then when I dive in deeper, dig in further, they open up about a sagging breast or a loose tummy, or sometimes as your conditions like stress incontinence or relaxed vagina. So this takes time for me to dig into the patient's history, and when I actually spend around an hour, the patient opens up comfortably with all her complaints. See, sometimes the complaint may not be a very major problem, but a simple lift of a breast will kind of reboost her whole confidence level. Her lifestyle changes. With that confidence, she works on getting better and better in her society.
Actually, that is so true. First, when a patient comes to me for a gynec checkup, they will talk about urinary infections or vaginal dryness or vaginal infections. But slowly, when I provoke into their history, that is when they say they have urinary leakages issue or lax vagina, not able to have a proper sexual life, and all these things come up eventually during history time when I provoke a patient on such questions, or else these questions stay hidden. So patients hardly come to us about to talk about all these things. So coming to mommy makeover surgery, Deepthi, so what surgeries do you deal with in a mommy makeover?
A mommy makeover completely deals with getting back the patient to her original pre-pregnancy state. Let any changes that happen in the pregnancy, say for example breast changes, abdominal wall changes, some generalized laxity in her skin around the waist and back and all, and there could be a saggy buttock sometimes. So the first primary changes that a patient observes after pregnancy is breast changes, because it's very physically visible to everybody around. Women kind of start losing the volume in the breast after delivery and lactation. So this gives a very saggy appearance to the breast. In the part of sagging, breast pulls out the complete weight on the back of the lady. So the women develop upper back pains and lumbar aches to a great extent. Most of the women who I have seen asked for a good cleavage definition, because that is lost very predominantly after pregnancy. For that, we can do a simple fat transfer. It is not a major problem. We just have to take out around 50 ml of fat on each side of the breast, and that's kind of very small daycare procedure. The women does not have to get admitted or anything. Also, she can go back home also very easily. And also dealing with sagging breast, we will have to do a mastopexy kind of a lift kind of a procedure. This will put back the weight of the breast onto its actual position and reduce the stress on the vertebra. I have seen after many surgeries, especially when it's breast, immediately on the post-op table, patients have told me, "Doctor, why did I even delay this for so many years?" That was amazing. The kind of relief that we see on their faces is simply amazing. And coming to the abdomen, a lax or loose abdomen, many women have this thought that we have to live with this after pregnancy. They don't know we can get so many procedures done. I have seen a woman who has lived with a lax tummy around for 20 years, and she didn't know she can get a tummy tuck or a procedure, something like that, done at all.
They don't know if it is actually fat or if it is a lax muscle or if it's a hernia or if it's a rectus divarication.
They keep on working, losing the fat, but losing the fat is not a solution for a lax tummy at all. I know there is a lot of issues on body shaming and all these things, but come into the shoes of a lady who's given delivery. For her, working on the abs continuously, working on losing the weight and all will not give a solution, and this will kind of demean her every day further when she's trying and she's not getting the result. So in those situations, it is always nice to go for a surgical procedure because we have an option, and a safe option. It is not even something which is going to disturb your day-to-day works at any level.
These surgeries, I feel they are not just for even tightening the skin or whatever. They boost so much confidence in a post-pregnant lady.
Yes.
They actually, the lady, she starts feeling confident, she starts feeling happy.
Yes.
So she walks more confidently outside, she'll enjoy her parties. Also, work culture. I think in the work atmosphere also, the more confident they are, the more properly they can deliver their entire
And the best
work.
thing, this will also help in taking care of her own kids very efficiently.
They are happy, the family is happy.
Because her body is cooperating for all the activities. And apart from these surgeries, there is an option of buttock augmentation, wherein again it will help back gain a woman's hourglass figure very easily. It is just a simple fat transfer. We don't even have to do a major surgical transformation there, and it kind of lifts back the buttock look, and the hourglass figure is instantaneous.
So I think it's not only about getting some surgery done for this thing. You can feel more happy,
Yes.
confident, and go for it.
Yes.
And it's not about not working out. Please do your workouts properly. After everything is done, get your self checked, and if you want, you go for it. And finally, workout, everything is to be continued for sure. So after these surgeries also, now many people have these questions like, once I get a surgery done, is it permanent?
Permanent, yes. See, most of the surgeries are permanent to an extent in terms of the result for that day. But what if you're again relaxing down, not taking care of your weight or your activity? Then probably you might again end up, see, that's a general weight gain process. It's not because you got mommy makeover done that you'll have to go for another surgery. Okay, coming to these topics, everybody knows about breast changes, tummy changes, and buttock augmentations in mommy makeovers. It's well spoken nowadays, but there are some hidden problems with deliveries which people don't talk about or shun about talking. So coming to aesthetic or functional gynecology, what are the changes that you have observed over a period of time, and how are people opening up about it?
They are still trying to open themselves, but yes, so following these natural births, normal deliveries, which everyone has to go through, there is no other option not to go through them. So after we go through these deliveries, there is lot of vaginal laxity, and there might be lot of tears during delivery which have to be sutured properly, finally leading to some laxity. So we can deal with this laxity. Many people face problems post delivery with vaginal laxity, having vaginal farts, or having they are not sexually happy, and all these things. So for this we have non-surgical and surgical options also. Non-surgical, we can tighten the vagina with lasers, or surgical, we can go for vaginoplasties. These are again very simple procedures, not like a major surgery. We have to just tighten little bit of mucosa inside vagina, and all the muscles we will tighten, and it will be like a good pre-pregnancy vagina. And the patients are also very happy. There will be a downtime of 3 weeks to 4 weeks post procedure. And apart from this, many patients face issues like urinary leakages issues and all these things post deliveries because of their hormonal changes, or the weight of the baby, the delivery stress on the bladder, etc. So for all these things also, we'll first assess the patient. Then we have again non-surgical, surgical options for both for this same issue. And accordingly, we can actually help a woman, and we can make her feel more confident and not wear any diapers because of these urinary leakages issue, and get back to your routine. So finally, a proper diet, lifestyle changes, exercises are compulsory pre-pregnancy, throughout your pregnancy, and also post-pregnancy. to maintain your health and physical status. In case if you have more issues, you can always come and see us.
You can always come and meet us because there might not be just surgical options for all your problems. There could be some non-invasive options too, which you might be missing in case you're not talking to your doctor.
It might be just a simple thing, but then yes, it is a thing.